The Greener Primary Care Wales Framework and Award Scheme, led by Public Health Wales, was launched nationally in June 2022. A first of its kind in Wales, the scheme supports the 4 independent primary care contractors: general practice, community pharmacy, primary care dental, and primary care optometry to build climate-friendly actions into their day-to-day practices. This video has been specifically developed to look at the great examples of the framework actions that have been implemented within dental practices, with a specific focus on the Rwabon Road dental practice, an independent practice in Wrexham, North Wales. This dental practice, a Gold Award winner in 2022, has been actively taking steps to reduce its carbon footprint with the aim of enhancing the health of its practice population and offering sustainable dentistry choices and services. Rwabon Road is the largest dental practice in the Wrexham area, with 9 modern treatment suites and an on-site dental laboratory. The front-facing practice is in a conservation area, preventing any physical changes to that side of the building. The practice submitted an application to Wrexham County Borough Council to have solar panels on the front considered, but it was rejected. A site visit found an area on the rear of the building that, whilst not as effective as the front of the building, would still produce relatively good results. As such, a 9-panel solar system has been installed. The system produces 3,290 kilowatt-hours per year of renewable energy and decreases the environmental impact of the practice. Dental practices are often open for long hours, and energy use is therefore a key consideration. In addition to the renewable energy generation, the practice is also focused on actions designed to reduce energy demand, such as monitoring energy use, installing specialist LED lighting, installing cavity wall insulation, installing loft insulation, and utilising energy-efficient equipment. An important aspect of the lighting within dental practices is the lux level. In order to see the patient's mouth properly, the dentist will require a lux of between 500 and 750. The Rwabon Road dental practice has modern LED panel lights which dissipate the lighting across the entire room. Transport is the primary contributor to dentistry's greenhouse gas emissions. A range of methods have therefore been proposed by the practice to limit patient and staff travel. As part of the framework, the practice has also focused on CO2 emission reduction strategies in relation to travel. The practice has an on-site dental laboratory and dental manufacturing facility. Having these facilities eliminates the need for car journeys to deliver laboratory work to and from dental laboratories, which is the current profile for many dentists. An area to lock up bikes has also been created to encourage staff and patients to cycle to the practice. The practice actively seeks to combine patient appointments, providing multiple procedures in one visit, with a greater use of high-end technologies that reduce the number of appointments. Other strategies which the practice advocates are to see families in one visit or to have family appointments. Virtual appointments are also promoted. The Rwabon Road dental practice is one of a few practices in North Wales with cone beam computed tomography, scanning technology, and clinicians qualified to operate and report its findings. CBCT scans produce precise, high-resolution 3D images of a patient's mouth. The scan gives detailed information that allows the dentist to assess the exact shape of the bone and plan treatment precisely. The transfer of images is all done digitally. These digital impressions, coupled with an on-site laboratory, eliminate the need for transport to and from laboratories. Having on-site specialists also reduce the need for referrals and additional patient travel. As part of the framework, the practice reviewed its systems and identified more areas that could become paperless. This included identifying digital solutions to replace personal records, patient treatment plans and consent forms, patient letters, personal prevention plan cards, receipts, and appointment reminders. The practice now keeps all personal records in digital format, including certificates and policies using the dental compliance software iComply. Treatment plans and consent forms can now be sent to the CliniPad so that patients can sign their plans and consent forms in practice on screen. The digitally signed consent form is uploaded and a copy emailed to the patient. Patients that have had a video consultation and did not attend the practice are emailed their treatment plan to sign electronically and return via DocuSign. Letters for outstanding treatment, outstanding payment, failure to attend appointments, and deregistration letters are now firstly sent by email or discussed with patients over a phone call. The practice has optimised its outside areas to promote health and well-being. A series of raised flower beds create a welcoming green space for patients entering the practice. A designated outside space for staff has also been created. The practice undertakes a number of actions to reduce dental plastic purchasing and waste. This includes promoting alternative non-plastic oral hygiene products such as bamboo toothbrushes. The practice recycles a number of different waste streams with specific recycle bins available for cardboard, plastic and food waste. The practice also supports initiatives such as Meat Free Monday.